Hello, everyone. My name is Cynthia Chavez, and I'm going to be doing physician allocation. So, imagine walking into a large hospital, checking in, feeling exhausted, and sitting on a cold, hard plastic chair for 1 or 2 hours for your name to be called. Anxiously, you rummage through your phone for a mobile game or try to catch up on some emails while the clock. Finally, your name is called and you meet the physician. You tell them that your symptoms, they prescribe medication, and then they are out in less than 10 minutes. This time crunch is extremely common among the patient doctor experience. According to one study, the authors found that the median length visit was about 15.7 minutes, with only about 5 minutes spent discussing the major issues. This time a person spends with their doctor is extremely short. With such a short time allocation between between patients, doctors are not able to get to the root of the problem, leading to some patients to come back. And this is having them come back worse. They already came in, because these are chronic conditions. It is not unusual for primary care doctor appointments to be scheduled at 15-minute intervals. Some physicians who work at hospitals say that they've been asked to see patients every 11 minutes. Short visits really strain the doctor-patient relationship. Patients tend to feel rushed with such short intervals of time dedicated to their illness. With less dialogue with their doctors, patients tend to leave more frustrated than when they came in. Shorter visit times also promote increased prescription use, where a pill is given to just solve the immediate problem, but not the underlying issues, such as a chronic condition. And these underlying issues occur because the patient needs to be paid for change. The primary care office becomes a revolving door for patients who continue on coming back since the root of the problem is not relatively being solved. So what does it all come down to? Money and a physician's shortage. For primary care physicians, time is literally money. Primary care physicians are paid mostly per visit, and with the new insurance reform, financial pressure is. So how did 15-minute appointments become the norm? It can all be dated back to 1992, where there was a Medicare time crunch, and basically its adoption of the Byzantine formula that relies on relative value units to calculate a doctor's fee. Since seeing this advancement, like private insurance is decided to hop on the bandwagon, and basically what a relative value unit means is just how many patients a doctor sees, and that's how they help. Physician shortage is also a factor that affects physician time allocation. With the influx of patients due to the Affordable Care Act, the physician shortage is growing. One projection estimates that by 2020, the shortage will balloon to about 40,000 physicians. 40,000 physicians, and basically, this is the rise of baby boomers. The problem particularly affects primary care for adults more than children, and the capacity is declining because only 9% of US students choose to be family medicine or internal medicine as their specialty. And it's affecting the growing demand for adult primary care from 80 million aging baby boomers. As demand implodes, the capacity to provide excellent care is limited. What can be done? With all these elements affecting the doctor-patient relationship, one could see patient care is declining by lack of funds, physicians, and resources. A couple of solutions that I see that can assist with the issue is incentivizing physician payments for favor procedure-based care um, over time-intensive evaluation management care. In this method, one can easily schedule a standard appointment, and if more time is needed, the patient or the insurance company could pay for extra time, and the physician would be reimbursed for the time. If the insurance company uh, paid for those extra minutes, the patient-doctor relationship would improve since the patient can expand more on their health issues and not feel rushed. This is one method that can assist with the growing issue. Another method or solution is increasing primary care reimbursement and graduating more nurse practitioners and physician assistants. Reshaping and even incentivizing the primary care specialty will not only assist in producing more primary care physicians and workers, but can also lead to changing Medicare payment policy, changing the current demand. So change needs to happen. We must focus on increasing primary care capacity and plant the seed in change in public policy. We need a new way of thinking. The current dynamic is causing more problems than it is solving. Patients shouldn't have to be rushed or feel like they're not being heard. The dynamic between doctor and patient should be one of trust, understanding, and really getting to the bottom of issues. In this matter, patients are incentivized to live a healthier life by finding out true issues that are leading to their diseases and hopefully taking the steps to change their behavior. By adding physician assistants and nurse practitioner, the workload is divided between more people, thus more staff for more patients. There's a more hands-on deck approach where healthcare providers would be able to allocate more time for patients since there are less constraints in staff. Also, giving medical students an incentive to choose primary care as a specialty can assist in increasing the shortage of having more doctors in. Overall, if the physician time is reserved for great patient care and if change to the current paradigm occurs, the health needs of patients. Thank you for listening, and I hope that you guys enjoy.